Hi, so I'm going to be doing advanced wound care today, and I do have an order for it. So I checked Mr. Booker's orders, and he has an order for an abdominal wound dressing change. So first thing I'm going to do is I would medicate the patient 30 minutes prior to the procedure, which I did. Next thing I'm going to do is use some hand sanitizer, and I'm going to gather my supplies. And then I'm going to hand sanitizer again, and I'm going to enter the patient's room. Hi, my name's Kate. I'm going to be your nurse today. Can you state your name and date of birth? And he would state his name and date of birth, and they match the orders. So at this point, I would be assessing for safety, and the room does seem safe to me. So Mr. Booker, today we're going to be changing the dressing on your abdominal wound. And the first thing I would do is get my, do hand hygiene again. And I'm going to put on my first pair of clean gloves. And I'm going to position the patient and put his chuck in the emesis basin right at the bottom of the wound. And I'm going to take off the old dressing, and I'm going to note that it has some bloody drainage, a little bit of bloody drainage, and a profound odor. So then I'm going to throw out the old dressing in the gloves. And then I'm going to do hand hygiene again. And then I'm going to put on my second pair of clean gloves. And at this point I have 50 milliliters of normal saline, so I would irrigate his abdominal wound from top to bottom or clean to dirty. So after I've done that, I am going to take off my clean gloves again and hand hygiene. So at this point, the procedure is going to become sterile as I put on my sterile gloves. So I would open them away from me. And then at this point I'm going to measure the wound and check for tunneling. So as I measure the wound, it is measuring 5 by 3 by 3 centimeters, and there is about a centimeter of tunneling. So then I'm going to have my irrigation tray, which is going to be sterile, and I'm going to moisten my 4 by 4 dressing with the normal saline, and I'm going to pack it with a Q-tip. So as I pack the wound, I'm making sure I'm not touching the edges of the wound with my fingers, and I'm going to pack with just the Q-tip and not my fingers. So again, I would not pack with my fingers, just the Q-tip. And then after that, I'm going to apply a new sterile 4 by 4 and a new abdominal pad onto Mr. Booker, and then I'm going to sign my initials, my date, and the time. And then I'm going to take off my sterile gloves again. I would clean everything up with hand hygiene, and then my FDAR note, my focus is wound care or impaired skin integrity. The data is that Mr. Booker had a wound measuring 5 by 3 by 3 centimeters, and it had a little bit of bloody drainage and a profound odor. And then my action was that I irrigated the wound with 50 milliliters of normal saline, and the response was that Mr. Booker tolerated the procedure well. He didn't complain of any pain, but he should still be monitored. His wound should still be monitored.